Hello, amazing people, and welcome to this our wonderful episode. We're talking about high blood pressure. High blood pressure or hypertension is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease. Blood pressure is determined both by the amount of blood in your heart or your heart pumps and the amount of resistance to blood flow in your arteries. The more blood your heart pumps the narrower your heart arteries are, the higher your blood pressure. A blood pressure reading is given in millimeters of mercury, that is mmHg. It has two numbers. Top number we call it systolic pressure, and the bottom number we call it diastolic pressure. So systolic pressure, that is the top number or upper number, measures the pressure in your arteries when your hearts beat, and the bottom number or diastolic pressure, which is the second or lower number, measures the pressure in your arteries between the beats. Okay, so you need to understand the systolic, that is the top number, measures the pressure in your arteries when your heart beats. The bottom number, which is diastolic pressure, measures the pressure in your arteries between beats. You can have high blood pressure for years without any symptoms. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. Fortunately, high blood pressure can be easily detected, and once you know you have high blood pressure, you can work with your doctor to control it. Mine is just fitness, and I bring you exercises you can do to control or to manage high blood pressure. We have so many symptoms of high blood pressure. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleed, but these signs and symptoms aren't specific and usually don't occur until high blood pressure has reached a severely high or life-threatening stage. So when is it good to see a doctor? You likely have your blood pressure taken as part of a routine doctor's appointment. Ask your doctor for a blood pressure reading at least every 2 years, starting at the age of 18. If you're around 40 years old or you are 18 to 39 with high risk or high blood pressure, ask your doctor for blood pressure reading every year. Blood pressure generally should be checked in both arms to determine if there is a difference. It's important to use the appropriate sized arm curve. Your doctor will likely recommend more frequent readings if you've already been diagnosed with high blood pressure or have other high risk for cardiovascular diseases. Children aged 3 and older will usually have blood pressure measured as part of their yearly checkups. So primary essentials for hypertension. For most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary essential high blood pressure, tends to develop gradually over many years. Let's go to secondary hypertension. So we have primary hypertension and secondary hypertension. So secondary hypertension, some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to appear suddenly and cause high blood pressure than does primary hypertension. Various conditions and medications can lead to secondary hypertension, which include obstructive sleep apnea, kidney disease, adrenal gland tumor, thyroid problems, certain defects you're born with, that is congenital in blood vessel, certain medications such as birth control pills, cold remedies, decongestants, over-the-counter pain relievers, and some prescription drugs. The other cause can be illegal drugs such as cocaine or amphetamines. So Anyway, high blood pressure can be managed, and the best way to manage is through exercise and watching what you're eating. Because I like handling high blood pressure as a condition, not as a disease. So if you want to tackle it as a disease, the solution will always be medication. When it's high, you bring it down. When it's low, you raise it high. But if you tackle it as a condition, you'll try to look at the root cause. What are the root cause? And you start working backwards towards you getting a better and healthier heart. So sometimes you may have complications. This excessive pressure on your artery walls caused by high blood pressure can cause damage in your blood vessels as well as your organs. The higher your blood pressure and the longer it goes uncontrolled, the greater the damage. So uncontrolled high blood pressure can lead to complications such that heart attack or stroke, which is high blood pressure can cause hardening and thickening of the arteries, which can lead to heart attack, stroke, or other complications. It can also lead to heart failure. To pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the wall of the heart pumping chamber to thicken, that is a left ventricular hypertrophy. Eventually, the thickened muscles may have a hard time pumping enough blood to meet your body's demand or the body's need, which can lead to the heart failure. It can also cause a weakened or narrowed blood vessel in your kidney. This can prevent these organs from functioning normally. Thickened or narrowed toned blood vessel in the eye, which can cause vision loss. Metabolic syndromes. This syndrome is a group of disorders of your body's metabolism, including increased waist size, high glycerides, decreased high-density lipoproteins, that is HDL, cholesterol, which we have the good cholesterol, high blood pressure, and high insulin level. These conditions make you more likely to develop diabetes, heart diseases, and stroke. So you've heard always doctors say a combination of both high blood pressure and diabetes is a bit fatal. That's why the last time we dealt with diabetes and how to manage diabetes through exercise. So today we are dealing with high blood pressure and how to manage blood pressure through exercise. So we are not expert. That's why we work hand in hand with doctors, getting referrals from the doctors, and once we write a working program for you, it has to be verified by a doctor, a certified doctor, a qualified doctor, to approve whether we are doing the right thing and we are heading towards making you a wholesome person. So these are amazing simple exercises you can do at the comfort of your home, and they don't require any equipment. You can actually tell we didn't use any equipment in this workout, and this is something you're able to do 20 to 30 minutes every day. So once you finish this workout from the first one to the last one, you are allowed to start all over again. So you take a shorter rest in between, you start all over again the workout, and you're able to do 20 minutes a day, which at the end of the day at the end of the week you're supposed to be done like 150 hours, 150 not hours, sorry, 150 minutes. So 150 minutes meaning you can do 20 minutes every day for 5 days or more, or 30 minutes every day for 5 days. You'll have achieved your 150 minutes. That is working out Monday through Friday, and you have the weekend to enjoy yourself. So guys, it's not hard to manage. Sometimes taking action is what is required of you. Take action of your health, and movement is the best medicine. We normally say movement is the best medicine for any condition, whether it's high blood pressure, whether it's diabetes, whether it's any other ailment. Movement is the best medicine. All we are doing here at Mokazi's Fitness is making sure at least you are getting your daily dose of exercise. Yeah, without complicating much, without putting so much strain, so much stress in you. We just ensure you have the best and the easiest workout you can actually do at the comfort of your home. So you don't need serious gym equipment. You don't need serious gym membership to manage high blood pressure, to manage diabetes, to manage weight loss, and lifestyle management in general. So all you need is start where you stand. Do the little thing that actually help you actually to live a better life now and in future. And when you do that, where I am seated, I'll be so happy that at least I helped someone reach some goals in life. That's my main goal in my life. That's my main target in this channel, to make sure at least you're having a quality life, a better life, and using the little resources that you have, exercise and diet. Both of them go hand in hand. So always remember to stretch after every workout. That's why we always end with a nice warm stretching. So at least you can lengthen and you can make sure your muscles are working in good condition. Yeah, so stretching is important. And until the next workout, guys, kindly give it a thumbs up, tell a friend to tell a friend, and if it's one thing that actually you can share this video. Someone needs to see it, someone needs to hear it. Kindly share as much as you can. Until the next one, bye bye from me.